Hello, everyone, and thank you for joining us for this week's edition of Carry On, a podcast covering issues relevant to veterans and those who care about them. Carry On is brought to you by Nation's Finest. At Nation's Finest, our mission is to support America's military veterans and their families with a comprehensive approach to housing, health, and employment that helps them to achieve self-sufficiency and reach their full potential. With more than 30 locations in 15 communities across California, Arizona, and Nevada, each year we provide critical services and support to more than 7,000 veterans and their families. If you or a veteran you know need help, or if you'd like to make a donation, please visit nationsfinest.org or call 833-468-9676. I'm your host, Mark Miller, Army veteran and Communications Director for Nation's Finest. In today's episode, our guest, Dr. Fabiny, will talk about caring for older veterans. Dr. Fabiny is a clinical administrator and program developer at the San Francisco VA healthcare system with an interest in both improving existing clinical programs for older veterans and developing new clinical programs to better meet their needs. She's working on several projects. One is to support the expansion and refinement of early identification of those patients whose needs are expanding beyond the capacity of the primary care setting and provide them with assessments and support that will better enable them to live in the community for as long as possible. The second is the development of intensive supportive housing, a intensive supported housing site for formerly homeless older veterans at the Colma Veterans Village built by Mersey Housing. The third is helping to lead the San Francisco Veteran Health Care System to become a formally designated age-friendly health system with the Institute for Healthcare Improvement and the John A. Hartford Foundation. Dr. Fabiny holds an MD from the University of Wisconsin School of Medicine and Public Health in Madison, Wisconsin, where she also completed her residency in family medicine. She also completed a fellowship in geriatric medicine at Harvard Medical School, Beth Israel Deaconess Medical Center in Boston, Massachusetts. Her awards and honors include the Health and Aging Policy Fellowship from the John A. Hartford Foundation, the Charles McCabe Faculty Prize for Excellence in Teaching from Harvard Medical School, and the Nancy P. Kahn Community Service Award from Somerville Cambridge Elder Services. Dr. Fabiny, thank you so much for joining us today.
Oh, thank you so much for having me. I'm really delighted to be with you all today.
So, Dr. Fabiny, I want to jump straight into some questions here, as it sounds like the work you're doing is really fascinating. So we know you work on clinical programs for older veterans. What needs do you see emerging in the older veteran population that you don't necessarily see in younger veterans?
Well, there are many, and some of them, at least as far as we know now, are particular to this Vietnam era veteran population that we're caring for. The Vietnam era veterans, as they age, are very different than their predecessors from the Korean War and World War II. What we see is more traumatic brain injury and psychiatric illness, so mental health challenges, and more illicit drug use in this veteran population. And so the body and the brain take a beating when there's been a lifetime of alcohol use or illicit drug use, if there's been chronic mental illness that hasn't been well treated, and then the traumatic brain injury sort of wraps itself around that, because what happens when a person suffers traumatic brain injury is that obviously their brain doesn't work normally anymore, and it makes the veteran much more vulnerable to more cognitive impairment or dementia, which is cognitive impairment, than somebody who doesn't have traumatic brain injury. So when you have a combination of traumatic brain injury that perhaps is evolving into dementia, a long history of alcohol or drug use can also contribute to developing dementia. And then psychiatric illness or mental health problems on top of that, it can render a veteran really unable to care for himself in the way that he used to. And oftentimes what we see too is that it's made it hard for the veteran to maintain important relationships with people in their lives, so that oftentimes these veterans are
It looks like Dr. Fabiny is frozen on us here for a moment, but hopefully we can get her right back. Dr. Fabiny, can you hear us? Hopefully we get her connection back here shortly. So it sounds like what Dr. Fabiny is saying is that some of the issues that all veterans face with substance abuse and also with traumatic brain injuries, that those manifest over time, and then some of the issues facing older veterans are those exact issues that that are caused by perhaps behaviors early in a veteran's experience, that substance abuse and traumatic brain injury can then manifest into some unique things later in life. Am I catching that correctly there?
That is right. And so oftentimes those veterans don't have the support network that younger veterans have, or that their Korean War or World War II peers had. And so veterans rely more on organizations like Nation's Finest or the VA, because they really don't have family members, they don't have friends who are able or willing to make sure they take their medications, make sure they're eating okay, somebody's paying the rent, that sort of thing. So we find that the VA, and I think that's what Nation's Finest is also discovering too, is that these veterans are much more reliant on organizations like ours to provide support.
And glad that both of us can help to provide that support.
Yeah. And so the one challenge that the VA is meeting, and I know that Nation's Finest is as well, is really shifting how we identify these veterans, how we offer them support, the kind of support that we offer them. We're really changing the way that we identify and support these veterans, because the way we used to do it, we discovered, doesn't really work.
So that really brings us to our next point. What I wanted to ask you about was, we covered briefly in the introduction some of the programs you're working on, but could you describe one or two of those programs that you're working on with a little more detail? We'd love to hear more.
Oh yeah, and I could go on forever about these two programs because they're so near and dear to my heart, but I'll stick to the high points. So the program that we implemented it's almost 2 years ago, as the Colma Veterans Village. And that is a permanent supportive housing site, as you mentioned, built and operated by Mercy Housing, that houses 65 mostly older, medically complex, psychosocially complex, oftentimes frail veterans who have a longer history of being homeless. And so we know that simply housing somebody who has been unhoused for a while is the first step to helping them have the lives that they want, but it can't be the only step. And so the innovative model that we've put into place there is a primary care team that consists of me as the doctor, a full-time nurse, he's a primary care and mental health nurse, full-time social workers. We have a recreational therapist there. We have a peer support specialist or a community health worker, and a psychiatric nurse practitioner. And that team has as its panel of patients and site of care, the veterans who live there. And so we're on site, and even during the pandemic, we were all on site providing care to veterans, and we see them in their apartments. They come down to the wellness center, and we're really able to get to know the veterans in a way that is hard to do if the care team isn't on site. So we are better able to identify challenges with mental health, physical health. We're better able to offer them preventive health services. We've already been able to see that veterans who we support make better access of primary care and of outpatient mental health care, and they go to the emergency room less often and get hospitalized a little bit less often because the team is really there. We really wrap our arms around the veterans. And the other thing that our daily presence there facilitates is developing trust. As you know, if the veterans don't trust us, nothing can happen. And because we just keep showing up, and there's a lot of trust that can be built when you just keep showing up every day. And if they're angry with us or upset with us or dissatisfied with what we do, we just keep showing up and we keep trying to get it right. And we really meet them where they are day after day after day after day. And I know that that's the approach that the staff at Nation's Finest takes too. It's just really important for them to feel that we might disappoint them, but we don't give up.
I think that's a great point, is that reliability and consistency means so much to this population, even if the services are a little off the mark or not exactly what they're looking for.
Right.
Meeting them halfway comes at a cost of reliability and consistency. So
right.
I think you're onto something very important there.
Yeah. Well, and also the VA as an organization has taken a whole health approach to supporting veterans' health goals. And so it's about the vets. It's not about us. And that's, I think, another thing that helps develop trust. We're not trying to force them to do anything they don't want to do. It's really about what's important to them. And we try to gain their trust by really always putting them at the center.
Absolutely. So in that same vein, in being about the veteran, doing what's best for them, I was wondering if you could shed some light for us, and you did with your very first answer a little bit regarding TBI and substance abuse. But with regard to veteran health and wellness, what can younger veterans do? There are a lot of younger veterans watching and listening to this. What could they do, or what would you tell their caretakers to avoid some of the challenges that you see with our older veterans? What can people do to avoid that when they're younger?
Well, I think, the culture of care here at the VA has changed even in the 6 years that I've been working here. And I think an acknowledgement of the toll of mental health stressors. And I don't come from a military background. I am not a veteran myself. And my understanding is that there is a culture there of, you don't show signs of weakness, you don't admit to any sort of frailty or difficulty, but that'll really come around to, pardon the expression, bite you in the butt as you get older, because you lose plasticity, you lose your ability to adapt and cover and recover as you get older. And if you haven't attended to your mental health needs and your physical needs for decades, that catches up with you. And at some point, your body and your brain just aren't able to recover any longer. And then you're really stuck with the impairments that you have. So I think that really seeking care when you need it. And it doesn't mean that you, as the veteran, need to hand yourself over to your healthcare or your behavioral healthcare providers. As I said before, the VA's really changed its position when it thinks about how it provides care to veterans, and is really learning better how to put the veteran in the center all the time. And so there's really an opportunity for younger veterans to come forward when you think you might have a problem with, drinking too much, or you're using drugs in a way that probably isn't healthy, or that knee that's really been bothering you, or that shoulder that's really been bothering you, or maybe you can't see as well as you did. Don't pretend. We are really here to help. And you, as I said, you can, and I know this is true for myself too, you can overcome impairments when you're younger, but to really acknowledge that as you get older, you can't. And you need to pay attention to them, because I can tell you, as someone who's taken care of older adults for over 20 years, it all catches up with you eventually.
And it adds up over time.
And
So
it adds up.
the message I'm hearing is you may have been a tough guy or a tough
Right.
gal during your military days, but when they're done, you don't need to cover up the issues anymore.
Right.
You can admit that that leg doesn't feel like it used to, or that
Right.
maybe you're using more of a particular substance than you should be, and it's okay to say, hey, maybe
Right.
this is something I medically need to address.
Yeah, or just with dealing with stress too, because your head's connected to your body, and just the accumulated toll of mental, psychological stress, it'll manifest itself in your body, whether it's pain or problems with your belly, or problems with your heart, or problems with your nervous system. Shakespeare wrote a long time ago, the truth will out. And your body can't hold on to secrets forever.
Those all come to the
They
surface.
all, that's right. They all surface eventually.
So bringing us chronologically to that point when maybe things are surfacing, if you would indulge us for a moment and maybe speak to the older veterans watching or listening, and what would you share with them, and what most important points could they take away with regard to their health and well-being?
Well, something that I've learned a lot more about since I've been at the VA is how important it is for veterans to talk with the people who love them and who are caring for them about what their wishes are for care as they get older, and also to talk too about who's going to be in charge of finances when the veteran's no longer able to really manage finances themselves. And a lot of veterans say to me, finances, I live on my Social Security check. I don't have finances. I don't pay taxes. All I do is pay my rent and buy myself groceries. I don't need anybody to manage my finances when I get sick. But you know what? You do, because you just never know where you're going to find yourself. And we regularly here at the San Francisco VA, and this is true across VAs around the country, veterans can get stuck in the hospital because they're no longer able to make decisions about their finances, but somebody has to make a decision so that the veteran can get out of the hospital. And once a veteran's no longer able to think clearly and decide, oh, I'd like my sister to manage my finances, or my daughter, or my neighbor, then we have to go to court and ask a judge's permission to have somebody named to manage the veteran's finances. And that is a process that takes a very long time, and means that veterans can get stuck in the hospital, or they just get stuck in some situation where some financial decision needs to be made, but it can't be because they never designated anybody to do that for them when they couldn't. So really the message that I would like to send to the older veterans and their family members or caregivers listening today is, please talk about the kind of care you would want when you get sick, and most importantly, who you want to be your medical decision maker. Because it's impossible to predict what the future is going to hold. Nobody has a crystal ball. But if you choose somebody who you really trust to make medical decisions for you, then that person, we hope, will understand what your general goals are and will make decisions in your best interest. So to choose a medical decision maker and have a conversation with that person about what your general goals are for your health, and then also talk to somebody about who you want to make financial decisions for you when you get older. And you can't make those decisions for yourself. And the thing to remember is that choosing somebody doesn't mean that they're taking your ability to make those decisions away. It just means when it's clear that you can't anymore, that there's somebody there to step up and do it for you.
That's a great point, and it sounds very similar to when military members are getting ready to depart for combat. They have
Exactly.
to establish a last will and testament, decide who's going to make their medical decisions if they're not able to, who will make their financial decisions if they're no longer able to. And it sounds like we need to call on that experience and say, even though we're not going to combat anymore, we reach a certain age where we say, hey, this is something that might not be comfortable to think about, but maybe something we should just get on paper and get out there just in case. It sounds like that's what you're saying.
Absolutely. It's exactly the same. They're completely parallel situations. And I hadn't thought until you said that of course anybody going off to deployment would have to make those same sorts of decisions. So fortunately, older veterans aren't going off to be deployed, but it's a different kind of deployment, I guess. It's not a military deployment, but it's sort of a life deployment.
Deploying into that next chapter of their lives.
Right. And actually that's useful information for me because I can remind veterans that they did this once before, and this is really just the same exercise at a different stage in their lives.
Absolutely.
Great.
Dr. Ann Fabiny, thank you so much for taking the time to join us today, and thank you for your continued service in the medical field, especially in this day and age when that's become one of the most important pillars of our society. And of course, thank you for your continued service to our veterans.
Oh, you are so welcome. It was such a pleasure to talk with you. Thank you.
Thank you so much. And a big thank you to all of you who joined us today. We'll be back next week discussing issues relevant to veterans and those who care about them. Again, if you or a veteran you know need help, or if you'd like to make a donation, please visit nationsfinest.org or call 833-468-9676. Again, thank you for joining us today, and as always, carry on.